Hello and welcome. This presentation will focus on the health of young Australians, and it will draw on statistics gathered from Australia's Health 2016. Firstly, a look at the good news. There has been a decline in death rates over time, but this is something that is pretty consistent across the entire population. So less people are dying today than were, say, 50 years ago. There has been declines in asthma hospitalisations, less people are contracting hepatitis, and more people surviving cancer. Smoking rates have declined significantly, and in fact they've halved in about 15 years. And illicit substance use has also declined. More young people are using contraception, and the majority of young people actually rate their health as good, very good, or excellent, so this is a good sign. Some bad news, however: rising rates of diabetes and some STIs, particularly chlamydia, high rates of mental health disorders, and particularly road transport accidents amongst males. There are far too many young people overweight or obese and not actually doing enough physical activity, and only a small proportion of the population are actually eating the correct amount of fruit and vegetables. There's still a large percentage of young people that are drinking at risky levels, and a large proportion of the population are exposed to violence or are homeless. There have been some improvements in these areas, but the rates still remain fairly high. There are also significant inequities that exist. For example, Aboriginal and Torres Strait Islander young people are significantly disadvantaged when compared to non-Indigenous young people. If you look closely, they're twice as likely to die from all causes, 6 times as likely to die from assault, and 4 times from suicide. And they're pretty significant numbers. You can see also that they're more likely to contract a sexually transmissible infection. Young females are more likely to be teenage mothers if they're Indigenous, and they're more likely to be in the child protection system or the juvenile justice system, and more likely experiencing income issues, overcrowded housing, and more likely to be a daily smoker. Those that live in rural and remote areas also experience inequity when compared with young people in major cities. And you can see that most of it relates back to lack of access to either health services or educational institutions. The Australian government has created a national strategic framework where it has outlined 6 objectives to measure the health of young people against. And the 6 objectives relate to active, healthy living, preventable injury and mortality or death, chronic disease, mental health, risk behaviours such as smoking, drugs and alcohol, and sexual and reproductive health. Now this is where it starts getting interesting. Objective 1, young people are active, healthy and thriving. The statistics suggest that a great proportion of young people are actually not in the normal weight range. You can see 57% of young people are actually in the normal weight range. That leaves 43% that are outside of that. And obesity can lead to many chronic diseases down the track, such as cancer, diabetes and cardiovascular disease. And similarly, we have plenty of young people who are not sufficiently active, and likewise increases the risk of cancer, CVD and diabetes. But of greatest concern is the lack of young people who are actually eating enough fruit and vegetables. Just 3.3% of young people are eating enough fruit and vegetables. So this can lead to serious chronic diseases down the track. It may not be present now, but when the young people reach an age where their lifestyle behaviours will catch up with them, it's going to be a cause for concern. You can see that Objective 2 refers to young people have lower rates of preventable injury and mortality. Now, the leading causes of death for young people in 2011 to 13 were suicide, land transport accidents, accidental poisoning and assault. Now you can see that suicide really relates to injury and poisoning and also mental health. So the issue with mental health is that it's not really getting any better, particularly if we look at reductions in smoking rates and alcohol consumption and illicit drug use. Mental health, we're not seeing the same kinds of declines at this point in time. So that's an area of concern, particularly for young people. Objective 3, young people experience lower rates of chronic disease. You can see that asthma has remained quite stable, 1 in 10 or 11% of young people. And we've got the most common reported long-term conditions in young people. We're seeing a bit of an increase in hay fever, and food allergies were reported for the first time in this report. But overall, when it comes to chronic disease, the older populations, I guess, are going to experience a lot more chronic disease because as people age, their bodies start to degenerate and so on. So this is an area that young people, I guess, their lifestyle is really important at this point in time so that they don't develop chronic diseases later on in their life. So looking at Objective 4, young people are supported in their mental health needs. You can see that according to the Young Minds Matter survey in 2013-14, 14% of young people experienced or had a mental health disorder in the last 12 months in the 12 to 17 year age group. Anxiety was most common, followed by ADHD and major depressive disorders coming in third. So whilst we're seeing some great progress with tobacco, alcohol and illicit drug use, we're not really seeing the same downward trend for mental health or mental illness. So given that suicide is the leading cause of death, this is an area that needs to be addressed through health promotion. Now, in terms of young people and risk behaviours, Objective 5, we can see that alcohol consumption has actually reduced over time. It was 39% most recently, and it's down from 49% in 2001. So that's a good sign, but that's still quite a lot of people drinking at levels that put themselves at risk. So still a cause for concern, but good to see that it's coming down. Daily smoking has reduced. It's almost halved, to be precise. 21% in 2001, and it's down to 11% more recently in 2013. So that's a good sign, but as we'll see a little bit later in the presentation, tobacco smoking is a significant risk factor for a number of diseases, and it's causing a lot of concern still, so it still needs to come down. Illicit drug use has also fallen significantly, so it's currently 25%, or in 2013 it was 25%, and finally, Objective 6, young people make sound choices about their sexual and reproductive health. We're seeing more people using contraception. However, we're still seeing that chlamydia notification rate quite high and having increased since 2005. So that's a cause for concern. So the area of sexual health obviously is an area that requires some health promotion. It's interesting to look at the top 5 leading causes of premature death by age, and you can see, if we look at 15 to 24, that suicide is the leading cause of death, followed by land transport accidents, accidental poisoning, assault, and event of undetermined intent. That just means it's unclear what caused the death. And we've also got 45 to 74 age group, we have coronary heart disease, and we have lung cancer as leading causes of death. So very different causes of death. Suicide obviously is linked to mental health and injury and poisoning, so obviously that needs to be addressed. Mental health is an area of concern for young people, and health promotion needs to target that area to try to reduce the impact of it. But there are also a number of risk factors that occur during the younger stage of people's lives that might lead to coronary heart disease and lung cancer. So we still need to reduce smoking. We need to reduce alcohol consumption and get young people to eat better so it reduces their risk of coronary heart disease later on in life. And it's also important to think about the actual risk factors that are leading to the greatest burden in terms of disease, and tobacco use clearly stands out. We've seen a decline in people smoking on a daily basis, and however, that still needs to reduce even further for us to reduce chronic disease. High body mass or overweight, obesity, alcohol use, physical inactivity and high blood pressure are all areas that can be modified or changed or reduced through behavioural or environmental changes. So if we reduce these risk factors, we're likely to reduce the burden of disease later on in people's lives. So it's important to address those through health promotion. Thank you very much for listening, and please ask your teacher if you have further questions.